Good evening, ladies and gentlemen, and a very warm welcome to all of you to the 29th presidential induction of the College of Community Physicians of Sri Lanka. In a couple of minutes from now, it will be time for us to welcome our distinguished invitees in our midst, including, of course, our chief guest, who is Mr. Marc-André Franche. He is the United Nations Resident Coordinator in Sri Lanka. Our guest of honor is Mr. Kunle Adeniyi, Representative Sri Lanka, Country Director Maldives for the United Nations Population Fund. And we also have the other dignitaries and council members who will now be making their way into the hall in a ceremonial procession. Well, ladies and gentlemen, with our ceremonial procession now inside the hall, may I request you all to please remain standing for the national anthem of Sri Lanka.
Sri Lanka Mata, Upper Sri Lanka, Namo, 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 Namo Mata. Sundara Siri Barini, Surandi Ati Somamana Lanka. හද තුල බන්ති ඔබ අප ආලෝකේ අපගේ අනුප්‍රාණේ ඔබ අප ජීවන වේ අප මුක්තිය ඔබ වේ නව ජීවන දෙමිනි නිතින අප කුබුදු කරන් වාතා ඥාන වීර්ය වඩවමින රැගෙන යනු වැඳ ජය භූමි කරා එක මවකගේ දරු කැළඹෙවිනා යමු යමු වී නොපමා ප්‍රේම වඩා සැලදේද දුරලලා නමෝ නමෝ මාතා අප ශ්‍රී ලංකා නමෝ 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 මාතා
Ladies and gentlemen, it's now time for the lighting of the oil lamp, signifying an auspicious start to our proceedings. May I invite the following dignitaries to please join us and brighten up this wonderful day. We'd like to be joined by our chief guest, Mr. Marc-André Franche, who is the United Nations Resident Coordinator in Sri Lanka. We have our guest of honor, Mr. Kunle Adeniyi, Representative Sri Lanka, Country Director, Maldives, United Nations Population Fund, President of the College of Community Physicians of Sri Lanka for 2023-2024, Dr. Shiromi Maduwage. We have with us Honorable Parliamentarian of the Democratic Socialist Republic of Sri Lanka and Public Health Specialist, Dr. Sudarshini Fernandopulle. Outgoing President of the College of Community Physicians of Sri Lanka, Dr. S.M. Arnold. To represent the past presidents of the College of Community Physicians of Sri Lanka, Dr. Manal Fernando. To represent the fellows of the CCPSL, we have Dr. Chitramali De Silva. President-elect of the College of Community Physicians of Sri Lanka, Dr. Kapila Jayaratna. Secretary to the Ministry of Health, Mr. Janaka Sri Chandragupta. Secretary to the Ministry of Buddhasasana, Religious and Cultural Affairs, Mr. Somaratna Vidanapathirana. Additional Secretary Development at the Ministry of Health, Mr. Sunil Galagama. Additional Secretary Public Health Services, Ministry of Health, Dr. Lakshmi Somatunga. Representing the academia and the membership of the CCPSL, we have Public Health Specialist, Professor Shamini Pratapan. Representing professional colleges, we have President of the Sri Lanka College of Obstetricians and Gynecologists, Professor Hemanta Dodampahala. Representing all the partners, we have Chairperson, Indira Cancer Trust, Dr. Lanka Jayasurya Disanayaka. Secretary of the College of Community Physicians of Sri Lanka, Dr. Anuji Gamage, and Treasurer of the College of Community Physicians of Sri Lanka, Dr. Pubudu Chulaseri. Let's invite our dignitaries now to please join us in the official lighting of the oil lamp. Ladies and gentlemen, please remain rising as I invite our dignitaries to take their seats at the head table on stage. We're delighted to be joined on stage by our chief guest, Mr. Marc-Andre Franche, the United Nations Resident Coordinator in Sri Lanka. We'd also like to be joined by our guest of honor, Mr. Kunle Adeniyi, Representative Sri Lanka, Country Director Maldives, United Nations Population Fund, President of the College of Community Physicians of Sri Lanka for 2023-24, Dr. Shiromi Maduwage, outgoing President of the CCPSL, Dr. S.M. Arnold, Secretary of the CCPSL, Dr. Anuji Gamage, and Treasurer, we have Dr. Puvudu Chulasiri. We invite our dignitaries now to please take their seats at the head table. Meanwhile, all of you in the audience as well, ladies and gentlemen, can feel free to now take your seat. Well, on that note, good evening to all of you once again, ladies and gentlemen, and a very warm welcome to the 29th presidential induction of the College of Community Physicians of Sri Lanka. Now, as all of you in the audience are aware, the College of Community Physicians of Sri Lanka, or CCPSL, is the nation's foremost professional body of public health practitioners. Its membership consists of specialists and medical officers qualified in community medicine, working together to promote public health through a professional approach. The college is dedicated to organizing programs on community medicine for the welfare of the people, as well as increasing awareness on the subject amongst the public. The college also strives to promote fellowship with and assist persons and institutions engaged in the practice of community medicine. Now, this evening, at the 29th induction ceremony of the college, we mark yet another glorious and significant milestone in the journey of CCPSL. Today, a new president, Dr. Shiromi Maduwage, will assume office as she pledges to strive to set and redefine the standards for excellence for this institution. The theme under Dr. Shiromi Maduwage's presidency is public health through fostering collaboration and building resilience. And as this evening progresses, we will be happy to share with you more about the very significant meaning behind this thoughtful theme. As we get started with our event, ladies and gentlemen, we're happy to share with all of you that this induction ceremony is also going live online via Facebook and YouTube, providing an opportunity for all of the well-wishers who are unable to be here physically to join us and be a part of the ceremony. So, therefore, we acknowledge all of the guests who are watching us online right now, and we're happy to have their presence with us virtually. With that being said, ladies and gentlemen, we're delighted to now officially commence our proceedings by extending a warm welcome to all of you for giving us the gift of your presence here this evening. To now do the honors of delivering the official opening address, it's my pleasure to invite to the lectern the outgoing president of the College of Community Physicians of Sri Lanka. Let's put our hands together, ladies and gentlemen, for Dr. S.M. Arnold.
Ayubowan and good evening, inducting president, council members, past presidents, and the fellows of the College of Community Physicians of Sri Lanka. Our chief guest tonight, Mr. Marc-Andre Franche, United Nations Resident Coordinator for Sri Lanka. Guest of honor, Mr. Kunle Adeniyi, United Nations Population Fund Representative to Sri Lanka. Mr. Janakasri Chandragupta, Secretary to the Ministry of Health. Officials of the Ministry of Health, other ministries, academia, and representatives of development partners. Family members of Dr. Shiromi Maduwage, special invitees, distinguished guests, ladies and gentlemen. It gives me great pleasure and honor to extend a warm welcome to all of you at this induction ceremony of the 29th President of the College of Community Physicians of Sri Lanka for the year 2023-2024. The College of Community Physicians of Sri Lanka is the oldest and the first professional body established under a Parliament Act for the public health professionals in Sri Lanka. Currently, there are over 600 members working with a view of safeguarding the interests of its members and promoting public health in the country. By looking at the past, we are proudly announcing that our past presidents, council members, and membership have worked immensely to uplift the public health field nationally and internationally in many ways. We are very much sure that the 29th President of the College of Community Physicians of Sri Lanka, Dr. Shiromi Maduwage, will mark another milestone of the college to uplift the public health further with a multi-sectoral approach, especially focusing under the theme of public health through fostering collaboration and building resilience. I am most honored to welcome our chief guest tonight, Mr. Mark Andre Fronch, United Nations Coordinator for Sri Lanka, for gracing this occasion amidst its very busy schedule. Your presence here today is great strength for the college. We are privileged and honored to have our guest of honor, Mr. Kunli Adinei, United Nations Population Fund representative to Sri Lanka. Your presence indeed gives shine to the inducting ceremony. My appreciative welcome goes to all officials from the Ministry of Health and other agencies. My heartfelt gratitude and appreciative welcome goes to all the past presidents, fellows, council members, and all the members of the College of Community Physicians of Sri Lanka. I warmly welcome all UN partners. My gracious welcome goes to all special invitees, distinguished guests, and all of you who are gathered here today. Finally, I hope that we will have a successful coming year for the college with many activities to uplift the public health in Sri Lanka. I wish you all the best for the inducting president, Dr. Shiromi Maduwage, and the new council to lead a fruitful and rewarding year of 2023-2024. Let me now close by wishing you a delightful and stimulating year. Finally, let's have a look at the flashback of activities of the college during the 2022-2023 council term. Thank you.
දෙට බැඳිලා කාටත් නොකියා කොළඹින් කසාද බැඳලා මන මාලි කැරොල් කරත්තයක් කියාලා උඩ පැනවෙන හිනා වෙනවා ලිඳ ළඟ ඉඳලා දී සවස මුණ ගැසෙන්න මුකුළු පාන්න
Wow, ladies and gentlemen, let's put our hands together for a wonderful year that just went by. Judging by that video, it's been a power-packed year indeed, a year filled with varied and enriching activities. And of course, we say a big thank you to the outgoing president, Dr. S.M. Arnold, for his wonderful job done at the helm as the president and for giving us that lovely overview of the accomplishments and milestones of the previous year. Well, this evening, ladies and gentlemen, we are here to witness the induction of Dr. Shiromi Maduwage as the 29th President of the College of Community Physicians of Sri Lanka. It's now time for us to officially introduce the new President. To do the honors of the same, I invite the outgoing President of the College, Dr. S.M. Arnold, to join us up. Let's put our hands together one more time, ladies and gentlemen, for Dr. S.M. Arnold.
Thank you. Dr. Shiromi Manjula De Silva Maduwage had a primary and secondary school education at Holy Cross College, Gampaha, and Devi Balika College, Colombo. She graduated from the North Colombo Medical College, Sri Lanka, and obtained her MSc Community Medicine and MD Community Medicine degrees from the Postgraduate Institute of Medicine, University of Colombo. She underwent her postdoctoral training at Somerset Primary Care Trust, National Health Services, United Kingdom. There she has been trained on elderly health and health of persons with disabilities. Dr. Maduwage started her public health career as the Medical Officer of Health at Walachene and Gampaha. She is a board-certified public health specialist, currently working as the consultant community physician attached to the Youth, Elderly and Disability Unit, Ministry of Health. Being in her current position, she has obtained many achievements nationally and internationally. She is a council member to the National Council for Older Persons appointed by His Excellency the President of Sri Lanka. Dr. Maduwage has a passion on teaching and training. She is a visiting lecturer, examiner, supervisor, and a module coordinator in the Postgraduate Institute of Medicine for MSc and MD Community Medicine and Geriatric Medicine specialities. She is a visiting lecturer of the Faculty of Allied Sciences in the General Sir John Kotalawala Defence University, Sri Lanka. She is a researcher who holds many publications nationally and internationally. She has authored chapters in many international journals and books such as International Handbook of Elder Abuse and Mistreatment, Handbook on COVID-19 Pandemic and Older Person to her credit. She has represented many international fora on public health with a special interest to elderly care. She is a council member to the International Institute of Aging, UN Malta, Satellite Center for SAARC countries. Dr. Maduwage is honored as a United Nations Healthy Aging first ever 50 world leaders who are transforming the world to be a place to grow older. She is a WHO advisory group member on integrating the health and care workforces and has work experience as a consultant to the WHO Regional Office, Southeast Asia Region for Healthy Aging. Dr. Maduwage is an active member of the College of Community Physicians of Sri Lanka. She is a council member for 10 consecutive years and held the secretary post twice, treasurer post, and served as a conference chair for many annual academic sessions of the College of Community Physicians of Sri Lanka. She is a fellow of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, it is my pleasure to read out the citation of Dr. Shiromi Maduwage for the induction of the 29th President of the College of Community Physicians of Sri Lanka. Thank you.
Thank you very much, Dr. S.M. Arnold and Dr. Shiromi Maduwage. May we kindly request the two of you to join us in front of the head table right now. While Dr. S.M. Arnold has officially introduced the new president to all of you, ladies and gentlemen, it's time now for the formal induction of the same. So, to now do the honors of the formal induction, we will be witnessing the awarding of the Presidential Medal to the new president. So, I invite the President's Medal to please be brought forward right now. Okay, and with this, we are now going to recognize the new president of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, put your hands together for Dr. Shiromi Maduwage, the 29th president of the College of Community Physicians of Sri Lanka. We will now also be witnessing the awarding of the past president's medal to the past president now, Dr. S.M. Arnold, and this past president's medal will be presented by the current president, Dr. Shiromi Maduwage. So we invite Dr. Shiromi to do the honors now as we thank Dr. S.M. Arnold for his wonderful year of service as president. Let's put our hands together, ladies and gentlemen, for the immediate past president now, Dr. S.M. Arnold. Thank you very much to both Dr. S.M. Arnold and to Dr. Shiromi Maduwage. We appreciate Dr. S.M. Arnold for his dedication and contribution to the college. And of course, at the same time, we congratulate our new president, Dr. Shiromi Maduwage, for a year of great success to follow. Well, ladies and gentlemen, today on the occasion of the 29th presidential induction of this college, a distinguished invitee who has graced our occasion here this evening is our guest of honor, Mr. Kunle Adeniyi, who is Representative Sri Lanka and Country Director Maldives for the United Nations Population Fund. Allow me to please officially introduce him to you. Mr. Kunle Adeniyi took up his appointment as Representative for Sri Lanka and Country Director for Maldives on 17th of January 2022. Prior to this assignment, he served as representative of the UNFPA in the Gambia, and before that as head of office in the same country. He brings nearly 2 decades of experience in sexual and reproductive health and rights, human rights, public health, public policy, and law. His journey into development started as a senior program officer for Nigeria's National Agency for the Control of HIV and AIDS, or NACA. He also served as a special assistant and head of the Project Implementation Secretariat in Nigeria's Health Ministry before returning to the Nigeria's National Agency for the Control of HIV and AIDS as the head of legal and human rights. During this time, he was a technical lead for both the World Bank Credit Program and the Global Fund HIV grants in Nigeria. He is a Nigerian national and an alumnus of the John Hopkins Center for Communication Programs in USA. He also holds an MBA and LLM, a Bachelor of Law degree as well. So with this introduction, ladies and gentlemen, it's now our privilege to listen to our guest of honor address the gathering. Please put your hands together, ladies and gentlemen, for Mr. Kunle Adeniyi.
It always gets a little embarrassing to keep hearing that a lot of time. Dr. Shiromi, the freshly minted president, it gives me a great pleasure to be the first person to address you in your official position. And Dr. Arnold, the immediate past president as well, great honor to address you. Fellows, past presidents, council members, I must be mixing it all. Colleagues from the UN system, I see the president of SLMA, Dr. Vina, I see Dr. Susi, I see the additional secretary, everybody here. I think I know a lot of people in my almost 2 years in the country. it's always a pleasure to attend and be part of events of different colleges in Sri Lanka. A few weeks ago, I was with SLMA, the oldest college. Dr. Villa said that, and I always learn a lot from the shoulders of excellent practitioners of health that I continue to learn and appreciate the great work. But I have a particular bias for public health, which is what I consider as the bedrock of any health system. It is important to note that we always speak and relate to public health and community health as in a very general term. And someone once asked me, how do you even measure the achievements of public health practitioners? Oh, I say you only appreciate public health practitioner when there's COVID, or when there's a pandemic. We never, our surveillance systems, no one speaks about it. The work of public health practitioners is to really invest your time and energy so that we never panic. And that is why I really, really appreciate and I always love being amongst public health practitioners. Health is a vital aspect of life, as we know, especially for economic development. The level and distribution of health outcomes can be key indicators to the inclusiveness of a country's economic growth. The WHO describes public community health as a state of social, economic, mental, and using resources. It's so broad, so that people can be physically well, but achieve their aspirations. As I say, it's so broad that it only cannot really be a state of curative health. Since independence, Sri Lanka has adopted a free health policy, which to me is Sri Lanka's biggest social protection method and network. What has that brought us? It has brought us fantastic results in this country that we're continually proud of. Maternal mortality, an area where I work, where I go around the world talking about, Sri Lanka achieved what below SDG targets even before the SDGs were written. Infant mortality, life expectancy in Sri Lanka. These, I believe, are based on the good investments and practices that have been done to community level. So how do I take community health? I really speak about it as investments in people that might not be seen if we do not really go after them. It's that woman somewhere in Aurelia. It's that young child in particular, two areas that I visited in the last 2 weeks. And I saw the work of the essentially important heart of the public health system, the public health midwife, the MOH offices, the people who are not seen, but who invest their commitment, their passion, their energies in ensuring that that young child gets vaccinated, in ensuring that that woman receives antenatal services, in ensuring that that young woman who got pregnant gets the right information and services to have safe delivery. And at the top of that calendar is the public health practitioner, the doctor, the physician. So I congratulate you. It's always very important and emotional for me to be among public health physicians. Sri Lanka has achieved, like I said, great health achievement. But what has that led us to? It has also improved our aspiration in what we term as quality of care. And what does that mean? We love it. We love those beautiful big hospitals. That's what we love to go to. Those big centers with those huge machines. Curative care began to take much more attention than community health and community medicine. So we began to invest in people, cultures, that people began to prefer tertiary services ahead of community services that might be preventive. And that effort in sensitizing our community, that effort of that PHM are the major communicator to communities. We tell them, your sanitation matters. If you did this, maybe we would not need to invest in all these issues. We have essentially moved away from that. That's not strange. It is what happens. It's almost like a gift and a curse. When countries meet their development aspirations, we start to look at those big machines and equipment, and that's what we want to receive. We can potentially de-emphasize the effect of, again, I speak to that PHM, that public health midwife, even the work, even at Gamne Ladari levels. Those are key areas that we used to work and made attention. It is my hope and desire that the seemingly challenges that we seemingly are facing now, and I use seemingly very carefully, really gives us an opportunity to rethink our health system. And again, I see people here that we've had these conversations many times, Dr. Chito, Dr. Susi, Dr. Sapuma, that how do we really design our health system? Not really design, where do our investments go? Should that public health midwife, who again has to go walk or travel up mountain, up countries, how do we ensure that she has what she needs to do that? How does the community physician, how does he know that the work in the community is extremely important and not just want to stay in Colombo just because the conditions of living are a bit different? Community health really speaks about leaving no one behind. It means that we must shrink the inequalities that exist between our urban areas and our seemingly rural population. And it's important that anyone across the country, the 22 million people in this country, get those services. We at the United Nations Population Fund, I will not speak for the entire UN because I have my resident coordinator here who is going to speak about the SDGs and the major work of the UN. But we're so happy that we really work for women's health. And in the times of challenges, we've invested millions of dollars in bringing medicines, cure. And as I was speaking to Dr. Arnold before this, training and retraining of those community physicians and those PHMs is very important to us. So the PDM and the training is key, and working together with our partners in the Family Health Bureau, with also the college, it will be important to see how we strengthen this information. Providing information and services to people is very important. It is our belief that we can prevent a lot of the health challenges that we have in this country now. In reading, and just to close, the work of CCPSL, I saw a statement on weathering the economic crisis through health system efficiencies. I would not be doing justice without speaking to efficiency and effectiveness in our health system now, which we, all the health partners in these countries, try to speak about. Even an equitable distribution of resources is very critical to keeping Sri Lanka where it is. Sri Lanka's health system is still fantastic. It's probably one of the best in the region. We just need to maintain services and ensure that we don't dip. So it's essential that we work to change attitudes, change mindset. We can actually we strongly believe that we can do a lot with the resources we have now. So I speak to the Ministry of Health, I speak to all partners, I speak to government and policymakers to see how we can probably be more efficient with all the resources we have. The United Nations Population Fund commits to continue to work, especially for women and girls. It's important that the status of women, and as we speak about the issues around equity and social determinants of health, that we must continue to work against violence, gender-based violence. It's a health issue, it's a social issue, and until we stop making sure 60% of homicides in Sri Lanka is femicides. So you see it's a man killing his partner, the person he professes to love. We need to do more about that. Mental health is key. Counseling people is very key. Dr. Shiromi, I had 10 minutes to speak. It looks like I'm going over. I tend to speak too much. Dr. Shiromi Maduwage, the 29th president, I really congratulate you for this. We look forward to working with you. We understand your induction and your passion for promoting the issues of elderly persons and people with disability. It's key to the United Nations leaving no one behind people, and we continue to work with you. Dr. Arnold, thank you so much for your time and for your efforts here. Finally, I did not know that doctors dance to Sumihiri Pane. I thought, I thought it was for us, right? I thought you were the ones that would tell us not to, do those things. But it's good to know that doctors also have time to relax and have fun. Thank you so much. It's beautiful to join you, and thank you for listening to me.
Thank you very much to our guest of honor, Mr. Kunle Adeniyi, for the very insightful message to the audience. And of course, we appreciate our guest of honor's commitment to public health in Sri Lanka in his role as a representative Sri Lanka for the UNFPA. Ladies and gentlemen, this evening we are also deeply privileged that joining us here for this special occasion as our chief guest, we have Mr. Marc-Andre Franche. He is the United Nations Resident Coordinator in Sri Lanka. Allow me to officially introduce him to you. Mr. Marc-Andre Franche has served the United Nations for over 24 years. Prior to his appointment as the UN Resident Coordinator in Sri Lanka, he acted as the resident representative of the United Nations Development Programme, or UNDP, in Libya, promoting better governance, local peace building, and sustainable growth. Between 2016 and 2021, Mr. Franche led the Secretary General's Peace Building Fund in the Peace Building Support Office in the Department of Political and Peace Building Affairs, investing in over 50 countries worldwide to sustain peace. He also served as the country director for UNDP in Pakistan. He also served as a deputy director of UNDP in Haiti, and prior to that, he worked for UNDP in New York, Colombia, and Bolivia. So with this introduction to our chief guest, ladies and gentlemen, it's now our honor to listen to him address the gathering and share his message with us. Please put your hands together, ladies and gentlemen, for Mr. Marc-Andre Franche.
Very good. So, President of the Council of Community Physicians of Sri Lanka, past President, and fellows of the College, officials of the Ministry of Health, my dear colleague Kunle, dear colleagues, some of you who are also members of the community of the College of Community Physicians, distinguished guests, good evening. First, I'm really grateful for you inviting me here today to speak at the induction of the 29th President of the College of Community Physicians. I'm really honored to join you and to congratulate Dr. Shiromi Maduwage on her appointment. And congratulations as well to the outgoing President, Dr. Arnold. I was very impressed by all the achievements. You've been very, very busy over the last year. So it was wonderful to see all the achievements over the last year. Under your leadership, the college has continued to prioritize the needs of community health amid a very complex set of challenges caused by the pandemic, but also the economic crisis last year. The United Nations is very proud of its to be a long-standing partner of the college and looks forward to continue the collaboration in safeguarding and investing in public health in Sri Lanka. Most recently, we had the opportunity to take part in the 28th annual academic session in August, and my colleagues who participated in the sessions were really delighted to engage with you, learn from your insights, and discuss best practices in addressing emerging public health issues. The importance of physicians and healthcare workers in Sri Lanka today cannot be underestimated. I'm well aware that the recent years have tested the spirit of even the most dedicated. I've had the opportunity in my recent visit to the north to visit many of your colleagues working in the hospitals and the clinics, but also I've had, on a personal note, the opportunity to speak with many healthcare professionals in the last few weeks as my wife and I visited many hospitals as we prepare to as she prepares to give birth to our second child in a few weeks. So I've heard a lot of nurses, a lot of doctors, and a lot of challenges that they're facing on their day-to-day. The COVID-19 pandemic has cast an unprecedented challenge upon healthcare systems here in Sri Lanka, but around the world. Here in Sri Lanka, as many healthcare providers have borne the brunt of the pandemic. The battle against the virus was not just a clinical one. It was deeply personal. The recent economic crisis simply exacerbated these difficulties. Shortages in essential medicines and equipment transform routine tasks into daily challenges. Scarcity of fuel and electricity further threatened the functionality of critical medical infrastructure, placing an additional strain on an already stretched system. And an aging population here in Sri Lanka is also having implications on the country's disease burden, particularly non-communicable diseases, which now contribute to nearly 75% of the deaths in the country. The present-day challenges are demanding more from you, but with fewer resources at your disposal. We realize the choices every physician must make for their personal and professional journey. It is heartening for me to witness the dedication of those who continue serving your communities. Your resilience and commitment amidst so many challenges are admirable. As we navigate our way now out of this economic crisis, the United Nations continues to stand by Sri Lanka's healthcare workers. To facilitate an effective pandemic response, the UN supported the government in addressing the scarcity of vital supplies, including over 10 million pieces of personal protection equipment. The United Nations also helped accelerate the national COVID-19 response by facilitating the delivery of over 5 million vaccines through COVAX, partners such as the World Food Program and UNICEF. During the peak of the economic crisis, we help ensure delivery of essential medicines, which was a focus of our humanitarian effort last year. UN entities delivered more than 1.5 million vials of life-saving maternal and reproductive health medicines, thanks to UNFPA and others, and 400,000 vials of antibiotics. And in terms of long-term engagement, the World Health Organization has also been continuously with the Ministry of Health to implement evidence-based strategies that promote public health, including mental health care, which is increasingly important here in Sri Lanka. The National Mental Health and Emergency Plan is one great example of an initiative that has enabled both the expansion of the mental health helpline as well as emergency preparedness. However, more can and should be done to our response to complex crisis and to ensure that those of you who are on the front lines are supported. As the COVID-19 pandemic showed us, health emergencies are becoming increasingly globalized. They demand a response that involves a wide range of actors and countries. As part of the UN General Assembly in New York 2 weeks ago, heads of state and government representatives agreed on a new political declaration for enhanced multilateral cooperation to strengthen pandemic prevention, preparedness, and response. In line with this commitment, the UN Secretary General has proposed to develop a joint emergency platform. This would strengthen coordination of our collective response to international crises, including the economic and social impact of pandemics. Through the SDG stimulus launched earlier this year by the Secretary General, we aim to offset the extremely challenging conditions that countries like Sri Lanka have been facing due to these multiple crises. The role of Sri Lanka and other developing countries is pivotal to ensure global institutions are more representative, inclusive, and ultimately more effective. As the second largest employer in the Sri Lankan economy, the healthcare sector plays a crucial role for safeguarding livelihoods and advancing development. Going forward, we must continue to invest not only in public health, but push the reforms to strategically allocate resources in a fair manner and maximize efficiency in a context of fiscal challenges that won't disappear tomorrow. Together, we must advocate for equitable access to health services and ensure that poverty never impedes the right to quality medical care. The college provides a valuable advocacy platform to push these issues forward, to provide ideas and evidence-based recommendations to advance the Sustainable Development Goals. Your collective efforts have been instrumental in ensuring that Sri Lanka remains at the forefront of healthcare innovation, and Kunle has underlined many of those, and setting a regional benchmark for healthcare delivery and disease prevention. I look forward working closely with you to strengthen our partnership for the people of this country. Thank you very much.
Thank you very much to Mr. Marc-Andre Franche, for sharing your thoughts with us this evening, and we're deeply honored by your presence and participation as our chief guest today. Ladies and gentlemen, at the College of Community Physicians of Sri Lanka, with every new president that assumes office each year, we also have a new theme unveiled for their term that highlights a vision for the president's tenure. So we're delighted to announce that the theme under Dr. Shiromi Maduwage's presidency is public health through fostering collaboration and building resilience. It's now our privilege to hear from the newly inducted president of this college as she now delivers her inaugural address. So, with your applause, ladies and gentlemen, please join me now in welcoming the 29th president of the College of Community Physicians of Sri Lanka, Dr. Shiromi Maduwage.
Ayubowan. Good evening. Chief guest tonight, Mr. Marc-Andre Franche, United Nations Resident Coordinator, United Nations in Sri Lanka. Guest of honor, Mr. Kunle Adini, Representative Sri Lanka, Country Director, Maldives, UNFPA. Council members, past presidents, fellows of the College of Community Physicians of Sri Lanka, Secretary, Ministry of Health, Secretary, Ministry of Buddhist Affairs, officials of the Ministry of Health and other ministries, academia, professional colleges, representatives of UN organizations, distinguished invitees, ladies and gentlemen. It's with great pleasure to stand in front of you as the 29th President of the College of Community Physicians of Sri Lanka. I'm honored to deliver my presidential address on the theme Public Health Through Fostering Collaboration and Building Resilience. We as a nation is wading through difficult times, and the health sector is facing up to multitude challenges. After managing COVID-19 pandemic, which was facilitated by major contributions of all health staff as well as other stakeholders, now we are facing another challenge in the form of an economic collapse. With the sacrifices made by our citizens, we all are trying our best to restore the country to the level it had been. Now only that demographic and epidemiological transitions made different challenges for us to overcome their implications, such as becoming one of the countries in the Southeast Asia region with rapid increasing elderly population. In this process, the field of public health and the College of Community Physicians of Sri Lanka, as the apex body representing public health professionals, have got a critical role to play with collaboration and resilience. Hence, considering the given context, the theme selected for the year 2023-2024 is ideal. My address today will cover critical areas by starting from highlighting on necessity of further strengthening of public health services, emphasizing on the value of fostering collaboration and building resilience, and role of the College of Community Physicians in ensuring the benefits to our society on further strengthening public health services through fostering collaboration and building resilience. Let us begin by defining the scope of public health. In 1920, it was defined by CEA Winslow as I quote, "The science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals." I end quote. With the advance in public health, concepts like essential public health functions were identified as a list of minimum requirements that countries need to assure the effectiveness of public health in their own context. Public health model speaks under the technical term surveillance, risk factor identification, planning, implementation, evaluation, and interventions. The three core functions of public health, which are termed globally as assessment, policy development, and assurance. Thus, the public health services are not arranged haphazardly, but are based on evidence-based theories, principles, and good practices. Sri Lanka has been having a strong public health service. Infrastructure is blessed with century of years old health unit system. Every household in the country has been assigned into a specific medical officer of health area, which offers well-defined public health services based on life course approach. Public health services are critically important in achieving the targets under primary health care, universal health coverage, and sustainable development goals. Hence, like in all other settings, in Sri Lanka also there are ongoing continuous attempts to improve quality services. Distinguished ladies and gentlemen, having elaborated on the necessity of continuous effort to further raise the quality of public health services, let me move towards fostering collaboration and building resilience. Most of public health services and activities are termed as complex interventions. This is due to the multifaceted elements that are involved in their implementation. As explained by Willis, I quote, "Complex problems, including those related to behavior change at a population level, altering environments, rarely respond to single, simple, or one-off solutions. In contrast, complex problems require complex interventions involving multiple components that target multiple levels in socio-ecological systems that adapt, change in response to different contexts." I end quote. As such, in delivering these complex interventions, fostering collaboration becomes an essential strategy. Collaboration can manifest in forms of partnership, coalitions, as well as networks. There are proposed frameworks to achieve important improvements in the health, well-being, and the equity in the population. Focus needs to be drawn towards how one can use fostering cross-sector collaboration to improve well-being, while addressing number and quality of partnerships, investment in cross-sector collaboration, and policies that support collaboration. Collaboration in public health plays a major role in uplifting the population health to satisfactory standards, and its goal could be reached through programs, initiatives initially to be extended to a greater arena. However, these collaborations should be well planned, and the common goal should be agreed upon to all stakeholders. If not, theoretical benefits of it would not be achieved in practice, setting to the same level as expected. Establishing due governance and a process for collaboration and innovation need to be done sooner than later. During this process, clear and effective governance is mandated with accountability, transparency, and efficiency. Standards could be improved services to deliver on time within specific budgets and achieve the desired results. We need to create leverage on the available tools and resources for collaboration and innovation. The best practices, frameworks, and methodologies for collaboration in healthcare need to be clearly identified. The existing culture, relationships, or collaboration need immensely to be improved through fostering a culture of trust, respect, and learning among partners and networks can build, maintain strong and lasting relationships with our stakeholders. By nurturing with due care the culture and relationships for collaboration and innovation, we can create a positive and supportive environment for healthcare partners and networks to work towards set goals and targets. This will contribute to sustain and improve the collaboration performance and outcomes. Resilience is a term increasingly used in reference to an ability to withstand stress and serious challenges. And we need resilience at times of crisis, similar to what we are going through at present. It's commonly discussed in relation to how best to be prepared for major upheavals and challenges. Developing resilience health systems ensures countries could effectively prevent, prepare, detect, adapt, and respond adequately to recover from public health threats, while ensuring the maintenance of quality, essential, and routine health services in all contexts, including a fragile, conflict, and violent settings. However, for resilience to have relevance to public health, it must provide a framework which enables individuals and communities to withstand challenges such as poverty, inequity, unemployment, and other factors that endanger health and well-being. Distinguished invitees, what is the potential role that the College of Community Physicians of Sri Lanka in further strengthening public health services through fostering collaboration and building resilience? To begin with, let us appropriate the link between public health and community medicine. Community medicine is a postgraduate specialty that has close link with the concepts of public health. Literature describes community medicine as version 3 of public health. It enables the link of curative services with community and the illness prevention and promotion of well-being. The members of our college, both specialists and trainees, are in a position to contribute in further strengthening of the public health services through fostering collaboration and building resilience due to many reasons. They are being placed at national, provincial, district, as well as academia and at international organizations. They serve at medical administrative grade as well. Furthermore, they involve, link, and guide the service delivery at levels of institutions. These facts made them to reach the community in delivering public health services. The curriculum our members undergo in their postgraduate training equips them with the skills needed in delivering essential public health functions. In addition to generic training they receive, the dynamics and context of the working in institutions facilitate their potential roles in further strengthening public health services. The generic job description of the consultant community physician, which has been published by the Ministry of Health, contains 10 key tasks they perform. It is obvious that those key tasks cover many of the policy recommendations for building health system resilience. Furthermore, these exposures enable them to work on the 3 driving factors in the framework of culture of health initiative that I mentioned above, which determine the success of fostering collaboration. The College of Community Physicians of Sri Lanka always acknowledge the utility of collaborative efforts and building resilience of the system. Even the mission of our college goes as working together to promote public health through professional approaches. The college already is involved in various forms of collaboration, including partnerships with the curative sector, professional collaborations with other colleges, and networks with community organizations. Ways will be sought to further strengthen these collaboration, and contribution made for building resilience will be intensified in this council year through the sustainable manner. The College of Community Physicians Sri Lanka has been advocating policymakers and contributing to make the health workforce skilled, and has been guiding the community members in all public health related activities. I too, as the president of the college for the year 2023-2024, bear the overwhelming responsibility of the college mentoring this country in further strengthening public health activities through fostering collaboration and resilience. Let me summarize the salient points of my speech. Public health services have contributed immensely to the commendable success the country achieved in relation to other lower middle income settings. Hence, in sustaining the current progress and in achieving more, these services need to be further strengthened. The College of Community Physicians is ready to broaden the current contribution in this process. Not only that, we will utilize the collaboration and contribute to build resilience in our activities, but also we will catalyze and mentor the utilization of these strategies by other stakeholders as well. College of Community Physicians is blessed with membership who are capable of contributing process of strengthening of public health activities through collaboration and building resilience. As members of the College of Community Physicians of Sri Lanka, it is not necessary to elaborate more on our potentials, as when actions speak, words are not necessary. Our actions have already spoken. Distinguished ladies and gentlemen, I am convinced and confident that in the coming year, the council members and whole membership of the college would contribute with their maximum capacity, both proactively as well as reactively, in further strengthening public health services through collaboration and building resilience. Although we are having a formal vote of thanks, as a tradition, we formally assuming the presidency, this prestigious college, it's my pleasure to express my gratitude to those who deserve it, and to those without whom this would not have been a reality. I take this opportunity to pay my gratitude to our chief guest tonight and the guest of honor, who very humbly accepted my invitation and graced this occasion. Thank you very much, sir. And my dear council members, I thank you all for the encouragement you have been giving in all the time. Past presidents and the fellows of the College of Community Physicians, thank you very much for standing with me and guiding me towards the correct pathways. I thank the Secretary and all the Health Ministry officials and all my colleagues who supported me in professional endeavors of my life and grace in this occasion. Secretary of Buddhist Affairs and all the officials from other ministries, thank you very much for your continuous support. I thank my loving parents who insist in me sense of service and integrity from my early days and making all possible pathways for me to be where I am today. I thank my loving family members, in-laws, with a special word of gratitude to my husband and my daughter and son for their understanding, encouragement, support, and patience afforded to me throughout my career, and being a pillar of strength to me always. My heartfelt gratitude to my alma mater, Holy Cross Convent, Gampaha, and Devi Balika College, Colombo, for giving me rich values and attitudes for my solid foundation. My heartfelt gratitude to my teachers at school, undergraduate, postgraduate level, who added colors to my life journey. I am fortunate to express my gratitude towards my loving teachers today, as it is the World Teachers' Day also. I thank to the international organizations and professional colleges who have already expressed their willingness to be collaborative stakeholders with our college in the coming year. A special thank you to Professor Pushpa Fonseca and Dr. Chitramali De Silva for their continuous support and guidance. Dr. Chitramali De Silva, Madam, you are the person who opened doors for me to be the council, as a council member in this prestigious college, and since then, during my journey in the College of Community Physicians of Sri Lanka, I served 10 years continuously as a council member and held secretary post twice, treasurer post, and served many times as a conference chair to the annual academic sessions of the College of Community Physicians. My dear postgraduate trainees of community medicine, you all represent the future of our specialty as well as our country. While thanking you all for all your support in the past, present, and future, please bear in mind that I will be very much receptive to all your suggestions, and the college will be your forum as well. I thank you all for accepting our invitation and gracing the occasion. Thus, let me conclude my presidential address, wishing you all a pleasant evening. Thank you.
Thank you very much to Dr. Shiromi Maduwage for a very thought-provoking inaugural address as our president, and also, of course, for unveiling her plans for propelling this college as well as public health forward. We also thank her for her very sincere gratitude to everybody who's helped her out on her journey. With that, ladies and gentlemen, we're almost drawing close to the end of the formal proceedings, but before we move on to dinner and fellowship, it's time for a very important item on the agenda, and that is, of course, to say thank you to everybody who has helped us in making this induction ceremony a very special and significant event. So to now do the honors of officially placing on record our appreciation for each of our contributors, it's my pleasure to invite to the lectern the Secretary of the College of Community Physicians of Sri Lanka. Let's put our hands together for Dr. Anuji Gamage.
Thank you. Mr. Marc-Andre Franche, Dr. Kunle Adeini, past presidents, fellows, council members, members of the College of Community Physicians of Sri Lanka, officials from the Ministry of Health and other ministries, officials from the development partners and non-governmental organizations, distinguished guests, ladies and gentlemen. It's my pleasure to propose the vote of thanks on behalf of the College of Community Physicians of Sri Lanka at the ceremonial induction of the 29th President. Our profound gratitude to Mr. Marc-Andre Franche, United Nations Resident Coordinator in Sri Lanka, our esteemed chief guest. Thank you for your insightful words, especially for highlighting the importance of public health and collaboration. Mr. Kunle Adeini, the United Nations Population Fund representative for Sri Lanka and country director for Maldives. We are delighted to have you with us as our chief guest of honor. We sincerely appreciate your presence and support and encouragement it provides. Thank you for appreciating our services and being with us today. I would like to express our sincere gratitude to all past presidents, fellows, council and college members, higher officials of the Ministry of Health and other ministries, representatives of UN agencies, other professional organizations, and invitees. Thank you for joining with us today and helping to make the ceremony meaningful. I want to express my heartfelt gratitude to all our postgraduate trainees, MDs, and MScs, for their invaluable contribution and dedicated efforts in helping organizing this event. Your hard work and commitment were instrumental in making this a great success. Ms. Trishma Pinto, thank you for your exceptional job in comparing. Your enthusiasm and skill truly made this event memorable. We sincerely appreciate the support extended by our AV team led by Mr. Nilanga. Thank you for a job well done. There are too many institutions and individuals. We may have missed some. We ask for forgiveness for not specifically expressing our gratitude. Thanks to everyone who contributed to the success of the ceremony. We value your partnership and commitment. Look forward to maintaining our relationship in the upcoming year. Thank you very much.
Thank you very much to Dr. Anuji Gamage for those very warm words of appreciation to everybody involved in ensuring that today has been a memorable event. With that, ladies and gentlemen, we now draw the curtains on the 29th presidential induction of the College of Community Physicians of Sri Lanka. Once again, we congratulate and wish the very best to our new president, Dr. Shiromi Maduwage, as she and her entire council will look forward to a year of great success to follow. Ladies and gentlemen, very shortly, it will be our pleasure to invite all of you to join us for dinner and fellowship, so please do stay on. And meanwhile, as we now wrap up our proceedings tonight, ladies and gentlemen, we'd like to say thank you for enriching our ceremony with your presence. As we come to the end of the formalities, I request you, ladies and gentlemen, now to please rise as our dignitaries will leave the hall in a ceremonial procession. With that, thank you very much, ladies and gentlemen, for your presence, and we wish you a wonderful evening ahead. Thank you and have a nice day.